Okay, hi everyone, and thank you for being here. I guess I'll kick us off. My name is Arunima Krishna, and I'm an assistant professor in the College of Communication. The work I'm presenting to you today is an article where my co-author and I reviewed health misinformation scholarship in two major health communication journals, identified the major topics that had been covered by extant scholarship, and then advanced a definition of health misinformation. Next slide, please. Slide. Thank you. We reviewed all health misinformation related scholarship published in the Journal of Health Communication and Health Communication, and found that health communication scholarship centered primarily on these 6 topics. So based on this review of the literature, we began to re-examine traditional definitions of misinformation and specifically health misinformation. Next slide. So misinformation is typically defined as false and or inaccurate information. But we argue in that this articulation of misinformation is incomplete, at least for health-related contexts, and we base this argument on different social scientific theories. Misinformation is not just false and inaccurate messages. False and inaccurate data constitute misinformation if the recipient judges it to be useful. So simply inaccurate and false messages do not constitute misinformation. In order for such messages to be called misinformation, they must be accepted as being useful in an individual's problem-solving information search. Next slide, please. Based on this central argument, we offer this definition of health misinformation. Health misinformation is defined as the acceptance of false or inaccurate data as useful, A, despite exposure to accurate data, which is something we see a lot with issues like vaccine safety. B, in the absence of accurate data or messages to the contrary, or in informational vacuums, which was very much the case in the beginning of the COVID-19 pandemic. Because there wasn't a lot of scientific data on the virus and how it spreads, misinformation messages filled the informational vacuum created by people's need to reduce their uncertainty. And finally, within historical or contextual legacies. Tanner et al. Noted that widespread misperceptions and distrust arising from historical abuses of human subjects in biomedical research can be important barriers, particularly among minority populations. So historical factors and contextual factors are especially important to consider when understanding misinformation, especially in non-Western contexts. So for example, there were reports last year of skepticism in Pakistan over the COVID-19 vaccine, stemming at least in part from the fake vaccination campaigns that the CIA had conducted in the early 2000s in an effort to capture Osama bin Laden. So in contexts like these, misinformation is not just a function of lack of information or of informational vacuums, but it is also situated within historical legacies. Next slide. So I'm building a research program that seeks to understand not only the predictors and outcomes of misinformation, but also ways to correct such misinformation. One study that I thought I'd briefly share with you is one that I'm working on with my colleague, Dr. Michelle Amazine, who is also presenting her work today. And we're specifically working on correcting MMR vaccine misinformation spread on Facebook, which often happens in the form of narratives like this one, which are referred to as overnight autism stories, where the story talks about how a child who had been given the MMR vaccine starts displaying signs of autism, which quickly escalates into them becoming nonverbal and becoming diagnosed with autism that people incorrectly link with the MMR vaccine. And this is, of course, despite the fact that the so-called MMR autism link has been debunked by several studies. Evidence about correcting MMR misinformation with scientific data has been pretty mixed. So we're testing whether this kind of anecdotal or narrative-based misinformation can be combated by narrative-based counters, like the one you see in this example. So this example that you see in the comment to the main post is an anti-vax to pro-vax conversion story that we're testing to see whether it helps correct the original misinformation post. So I'll be happy to answer any questions that you might have about this, but I'll stop here for now. And thank you very much for your attention.